Hello, I am Dr. Tushar Maniar, and today we will be talking on importance of growth monitoring and how we should not miss out on growth monitoring. We know that head circumference monitoring should be done till 2 years of age and height must be measured till puberty. But remember that weight has to be monitored throughout life. Growth charts help in early detection of the disease, and I'll give you an example. Normally we say that a child, when they fall below 5th centile, then it is considered abnormal. But if you are monitoring regularly, any child who deviates by 2 percentile lines would become a red flag, and thereby prompting us to get into investigation or at least close monitoring to detect if there is any reason for growth failure, whether it is a major disease or whether this is an endocrine problem or whether this is a genetic issue. Not only this, it also helps you decide the timing of the disease. A child who comes to you who appears to be short or has less weight than the appropriate for age, if you have the growth chart, you can see when and what time did this problem occur. To give you an example, a child who comes to you at 2 years of age and who was growing normally till 6 months and suddenly starts showing deterioration of weight gain, one could suspect faulty weaning practices, whereas someone who was always low on the growth chart and continues to remain low on the growth chart, you may be less worried, thinking this could be genetic or constitutional. When I say genetic, meaning familial short stature or constitutional short stature. It also helps us in deciding the severity of the diseases, because we know that chronic diseases affect growth in terms of height as well as in terms of weight. And intermittent conditions or recurrent conditions like recurrent respiratory infections or asthma generally does not cause faltering of growth. So if we have a child with asthma who is falling off the charts, either we should revisit and see whether our diagnosis of asthma is correct or not, but it will also help us decide the severity of asthma, as any severe disease will eventually affect the health of the child. Growth charts help us decide what is the problem. If this child has a low weight to start with or low height, and this girl continues to remain below the normal centiles and also the gap is increasing, then you know that this disease is of early onset, and you can think of Turner's disease, Turner's syndrome, or you can think of some congenital endocrine problems. On the other hand, a girl who came to you at 5 years of age and has a growth chart which was apparently normal or near normal till the age of 3 or 4 years, and then the child started faltering, one could think about various causes like constitutional diseases or nutritional factors. We must remember that detection of protein energy malnutrition is also very important, and that can be easily determined with monitoring of growth charts. You have a child who is between the 3rd centile and 1st centile, one would think of it as moderate malnutrition. If the child is below 1st centile, you would call it a severe malnutrition. Similarly, if your child has height as well as weight, both are below the required limits, then you would think in terms of acute on chronic malnutrition. If height is more affected than the weight is affected, one would question malnutrition and want to look for if there is any endocrine problem, or did this child have malnutrition which on your treatment the weight is now improving and hence the weight is looking slightly better compared to the height. It also helps you decide whether this disease is acute malnutrition or acute on chronic malnutrition. In acute malnutrition, one would expect the height chart to be near normal and weight chart to be affected. As we saw, the growth charts are following a certain pattern. If we have to differentiate between a familial short stature and constitutional short stature, one would look at the growth charts and see if the child is within the mid-parental parameters or not. And also we can do a bone age to decide whether this child is constitutional or familial. We must remember that both constitutional and familial are what is called as growth variation and not necessarily short stature by definition, because their growth velocity, that means the child's chart, will be parallel to the percentile lines, though running at a lower level. Now, whenever the percentile lines are running parallel to your child's growth chart, there is less concern compared to the child's growth chart, which is cutting across the percentile lines. We also have to remember that so many diseases can be picked up early by growth monitoring, even before the clinical symptoms become obvious. To give you an example, if you are monitoring the child's head circumference regularly, even before the child gets into signs of raised intracranial pressure or in sunsetting or neurological signs, we would see that the child's head circumference is growing faster than normal, and one would be inclined to do investigation and rule out hydrocephalus, thereby preventing serious neurological disabilities. Similarly, there are certain conditions which are otherwise silent but can be picked up on growth faltering much earlier. To give you an example, conditions like renal tubular acidosis or chronic renal failure will have growth faltering as the only sign to start with. Similarly, children with celiac disease can have only anemia and growth failure. So if we are monitoring the growth charts, we may be able to detect this child before the child suffers major disease symptoms. We were talking all along only about low weight and low height, but we are in the middle of an epidemic of obesity. And we must know any child who is crossing the percentiles in weight but not going above, we would pull it overweight, and if it goes beyond the 97 centile, we would call it as an obesity. But if the child's trajectory of growth is higher, we must identify them early and try to do lifestyle correction measures and rule out other metabolic syndrome conditions. We have some children who are special and they require special growth charts to monitor them. Down syndrome children, children with Turner syndrome, and premature babies, all of them have their own set of charts. We need these charts because though we expect them to be on the lower side, we still need to make sure that they are getting adequate growth to make sure they are growing to the best potential, to their own best potential. Not only that, there are some medical conditions, for example, celiac disease with Down syndrome, where you would pick up if the child is not doing well on their growth charts. Finally, you may have a child with Turner syndrome who is now on treatment of growth hormone, and you want to see whether she is bettering her height on the growth charts. Remember, weight monitoring has to continue throughout life, and periodic weight monitoring on a bathroom scale for even middle-aged adults will help them detect obesity and many other cardiovascular complications. In senior citizens, it's very important to keep a track of the weight because loss of weight could trigger an investigation for an occult malignancy or even sometimes serious organ dysfunction. Thank you, friends, for a patient hearing. We meet again next time.